Hi, everyone. This is Ron Lapatan, the Community Outreach Coordinator with the Center for Health and Human Rights. And you may have noticed a lot on social media recently that we've been fundraising for our youth team's budget. So this video is to explain what is our youth team's project and why should you donate in this final week of our fundraiser. I'll start by explaining what the Center for Health and Human Rights is. We're a medical practice in Northern Virginia that provides free medical services to community members without insurance. This includes homeless individuals, refugees, and immigrants without insurance. In fact, in the next couple months, we're going to be launching a new clinic in Falls Church to provide services exclusively to local homeless families. In addition to providing all these services, we also want to strive to promote a dialogue about public health in our community. And this is where our Youth Teams project comes from. So, what we do for this project is we go into local high schools and we bring together groups of youth and ask them, if you could change one thing in your community about public health, what would you change? So, we get our youth to think about our community's pressing public health problems and then empower them to create innovative solutions and service projects to address those problems. And once our youth leaders have their ideas, we provide them resources and support to translate those ideas into reality. We support them through a budget, which is what our fundraiser is for. And our youth leaders also go through a curriculum to teach them about human rights and public health and how to translate an idea for change into tangible steps. So, to give an example of what these youth teams might look like, I'll talk about some of the clubs we've started so far and the projects they're working on. We have a group of students at Fairfax High School who founded their own nonprofit to empower youth in the foster system to finish high school. What they learned is that only about 30% of foster kids finish high school because of an often disempowering social environment. So when they age out of the system, a lot of them become homeless, incarcerated. They have an increased risk of teen pregnancy and human trafficking. And so our kids work 4 times a month with students in the foster system as a very strategic way of addressing all of these health problems at once. We have a group at George Marshall High School that noticed that a lot of their immigrant and refugee students don't feel accepted as part of the community. So their group is going to create spaces of conversation for students and faculty to come together and discuss how can we as classmates and members of this community make students who come from abroad as refugees feel like they are part of this community too. They also noticed that a lot of the immigrant and refugee students cannot afford female hygiene protection at home, and the school does not yet have a working system to provide access. So, another of the Marshall Group's projects is going to be creating a system to provide access to female hygiene protection for students. We have a group at Mount Vernon High School whose projects center around creating resources for homeless students. And they want to raise awareness also of the school's counselor so that the students know, hey, this person is here. You can talk to her about your problems. And we also have groups starting in Annandale High School and the International High School in Langley Park, which is in Maryland, which are both going to be led largely by the school's immigrant and refugee students, who are going to create projects to address problems that they experience in their communities on a daily basis. And in addition to all those clubs we've started having conversations with 17 other high schools about starting this program amongst their students. And we're going to keep outreaching to high schools until we've got every high school in the DMV area. So, what are the benefits we see coming from this Health is Right after school program? Well, in addition to transforming the community's quality of life through our youth leaders' service ideas, we also base this program on research done in Fairfax County on youth that identified 6 social conditions that greatly reduce a youth's risk of risk behaviors like early sex, drug and alcohol abuse, carrying a weapon, participating in bullying, and participating in gang activity if you have a key combination of 3 of these conditions in your life. So here's the graphic for that research. And the 6 conditions are having high personal integrity, performing community service, having teachers recognize good work, having community adults to talk to, participating in extracurricular activities, and having parents available for help. Our program is highly designed to cultivate five of these. The one we're missing is having parents available for help. So here's that graphic again. This arrow is where you get that key combination of three of those conditions. And you can see once you get to that point, all of the social behaviors start to go down. So the final result that we expect from this youth teams initiative is that we will not only have launched one clinic to provide free services to the community, but we'll have contributed to creating a new culture of health and human rights where people feel supported to have their human rights and to be healthy as just a part of the fabric and values of the community. So, I hope this video has helped to explain why our youth teams project and our budget is important and has encouraged you to donate to our fundraiser in this final week of our fundraising. So, thank you so much.